Hi, I'm Dr. Glueck with St. Peter's Bone and Joint, and we're going to talk more about knee arthritis, the diagnosis and treatment options for you. And I also want to remind you that you can see this video and others at the website sppj.net, as well as additional good information on other knee injuries and treatment options as well. Let's look more directly at the knee, and this is on this model, this is a normal knee with healthy cartilage covering the bone, and that's shown by this sort of bluish area here. You can see that as well on the tibial side too, and then the good meniscus padding here. So this is a normal knee. We contrast that to an arthritic knee in this model. We see differences, and that includes wear and tear of this cartilage, signified by this red area here. And what we'll see in arthritic knee is this will just wear out and essentially go away over time. We'll end up with a bone-on-bone appearance, which creates increased pain, swelling in the knee as well. Also shown on this model is bone spurs that start to develop, and that's in response to the lost cartilage padding as well too. Lastly, the other thing that you'll often see in a knee is that this will angle one way or the other where there's more loss of that joint space, and we'll talk more about that on the x-ray. We'll transition next to talking more about arthritis, its progression and treatment options, and then also following that talk more about knee replacement as well. So we just talked about the anatomy of knee arthritis and the progression of arthritis from good cartilage to worn out cartilage and those things that happen. We'd like to talk more about the progression of arthritis and how we treat that with patients to improve their function, decrease their pain. The ways that we talk about treating this are conservative measures, and those include decreasing weight. The more weight we can keep off the knee, the better it performs, the better it feels with it. So good healthy diet, good active lifestyle are certainly important. The other things that we will talk about for treating arthritic knees are anti-inflammatories, medicine that can decrease inflammation, decrease the symptoms as well. We'll also talk about bracing as a good option for patients. Brace can provide some additional support and stability to the knee for an arthritic knee as well. In addition to those things, we'll talk about treatment options which would include injections, and there's several different options for injections. Often we'll talk about a steroid injection, which can be very nice for quick relief of pain. It decreases inflammation and the symptoms for patients for months or more at a time. Other options are what's called viscosupplementation. That's a gel type of injection that acts as a lubricant in the knee, and that can be helpful for several months or more at a time as well too. So these are good options for patients to decrease their symptoms, become more mobile, more functional, until we may need to talk about knee replacement, which would be our next option. And knee replacement is something that is often considered when these other things are not helpful and symptoms become more persistent and affect really regular daily activity in life for patients. So in our next segment, we'll talk more about the knee replacement and how that works. We've talked about arthritis, how we diagnose this, and the typical treatment options as well too. I want to now share with you more about what a knee replacement means, what we do, and the procedure for that and the components. So let's look at the knee. This is a knee model showing, again, here's a kneecap in the front, and the work is done underneath that, and we can move that away, and now we can see what the components look like. If we take a look here, this is the femoral component. We'll show this on x-ray as well later, but this is the femoral component. If you look from the side view, what we really do at the time of the surgery is we essentially square off the ends of the worn out bone and cartilage and put a metal cap in place of that worn out ends of the bone. We do the same thing on the tibial side, and you can see here this is the tibia, and you'll see this on an x-ray, where we squared this end off, put a replacement with a metal component here, and then as well there's a hard plastic liner that essentially takes the place of that worn cartilage, and you can see the knee can bend on this, and this creates that same mechanism that we had with a knee before the knee replacement. The other thing that I think is important for patients to understand is how we enter into the knee, and what we really do with this is we make an incision along the side here, and then we can move this kneecap out of the way to get access to do the work that we do on the femur and the tibia. We keep the ligaments in place that are along the sides here. These are important stabilizers for us. Lastly, the other thing to recognize is that we will often consider replacing the undersurface of the knee. And on this model, we can see that we essentially put a plastic cap or liner on the undersurface of the patella here that then will sit into this space here and again allow the knee to bend in this motion here. So that's the basics of a total knee replacement. Many patients will also talk about or question if they'd be a good candidate for a partial knee replacement. On this model, we can see with there's just very localized wear in the knee where just one part of the knee is worn, we can do a replacement just to replace that section of the knee, leave the kneecap area and the other side of the knee in place. And this is a partial knee replacement. And on the side view, again, you can see that we've replaced the femur and the tibia, but we have not had to replace the other side of the knee here or the kneecap area as well. This is a good surgery for patients with very localized pain and localized arthritis. Okay, so let's look at an x-ray of a knee with arthritis in it. This is relatively advanced arthritis, and this was a knee that went on to a total knee replacement. First point is that we have a bit of a bow-legged appearance here. We can see this angles in this direction a little bit, and that's something that we address at the time of surgery. The other thing is that we have an arthritic knee with loss of cartilage here. We can see that we have bone-on-bone findings here. This means that cartilage space that we've talked about before has been lost and been worn out. And so this is a bone-on-bone arthritic knee. We see bone spurs over here as well too. On this side we see a little bit more space remaining, so a little bit cartilage remaining, but we also see the bone spurs that have developed here in response to that loss of cartilage. So let's look at a knee replacement after the surgery has been performed and the components are in place. And several things to look at as we look at the x-ray. The first is that previously we had a knee that was in varus alignment or a bit of a bow-legged appearance to it. Now we have a nicely aligned knee straight up and down through here. We can then look more directly at the components. This is the femoral component. Now is metal that's replaced the worn out ends of the femur. Same thing on the tibia side. We have a tibial base plate here with a stem that comes down in to the knee. And so these have essentially replaced the worn out ends of the cartilage. We also look on the x-ray and we can see in this case cement was utilized to bond the components, the metal components to the bone as well here. And so that's what we see on these x-rays here. This is a bit of a gray or white hazy appearance to it. The other thing that we see here as well too is the space in between, and this is a hard plastic liner that essentially connects the femur to the tibia and allows the knee to bend at this interface here. And that does not show up in the x-ray. That's why there's a space in between on the x-ray between the components. So in summary, what we see here is a nicely lined knee, straight up and down. Here we see the femoral component, tibial component, that hard plastic liner spacer in between. So in summary, we just looked at knee replacement options for patients and just looked at a partial knee replacement, and then also wanted to again show the total knee replacement where we replaced both the femur and the tibia and the undersurface of the kneecap as well too.